Bleeding during and after cancer treatment. What are bleeding problems? You may experience unusual bleeding or bruising at some point during your cancer treatment. This typically happens when you have a lower than usual number of platelets. Platelets are clot-forming cells in your blood that prevent or stop excessive bleeding. Bleeding can be internal, meaning inside your body, like a bruise, or external, meaning on top of your skin, like from a cut. If you notice any unusual bleeding or bruising, it is important to tell your care team. In this video, you will learn common causes of bleeding, how you can help manage bleeding, when to contact your care team, and when to call 911. Common causes of bleeding. Common causes of bleeding include thrombocytopenia, which means a low platelet count, medications, cancer treatment, cancer, and blood disorders, stomach and peptic or small intestine ulcers, injuries, and wounds can also cause bleeding. How you can help manage bleeding. To help manage bleeding, we recommend you take steps to prevent bleeding and to control bleeding if it starts. To prevent bleeding, do not take over-the-counter medications or supplements without first talking to your care team. Certain medications can increase your risk of bleeding. Examples include aspirin, ibuprofen, naproxen, Alka-Seltzer, or cold medications that contain these drugs. If you take medication for high blood pressure, take it as prescribed. High blood pressure can trigger bleeding. If you are told your platelet count is low, ask your care team for the Fred Hutch bleeding handout for tips on how to manage a low platelet count. To control bleeding if it starts, apply pressure to your bleeding site. For example, if you have a nosebleed, press your nostrils together firmly with your fingers. You can also wrap ice in a soft cloth and press it firmly against your nostrils. Hold pressure on the bleeding site for 5 minutes before checking to see if the bleeding has stopped. Try to stay calm if you can. Breathing exercises such as inhaling for 4 counts and exhaling for 4 counts repeatedly can help. When to contact your care team. Call your care team if you experience new or increased bleeding or bruising, blood in your vomit. It might be red or look like coffee grounds. Blood in your stool. It might be bright red or black. Blood or blood clots in your urine. A nosebleed that won't stop after 30 minutes. Many tiny red or purple spots on your skin or in your mouth that are the size of a pinpoint. A fall with or without injury. A hit or impact on your head even if you feel fine. If you menstruate, changing the pad more than you normally do or using more than 1 pad in an hour. Do not use tampons or menstrual cups. When to call 911. Call 911 now if you experience uncontrolled, constant bleeding or loss of consciousness. Thanks for watching this video. I hope you learned more about bleeding and what you can do if it happens to you during or after treatment. Call your care team if you have any questions or concerns.